to mute yourselves. This is a recorded call. I would like to welcome everyone to our Recovery Services RFP pre-solicitation conference, solicitation number 9884, specification number 1285307. This is with the Chicago Department of Public Health and the Behavioral Health Bureau. So our agenda today is welcome and introductions, purpose and goals, program overview and scope of services, eligibility requirements, available funding, data and reporting, staffing, evaluation rubric, key dates, and we're going to be saving questions for the end. So welcome, I'm Madeline Saldon. I'm a public health administrator in the Office of Substance Use. Please put questions in the chat during presentations. We share all the questions that we have during these presentations with everyone who is applying to this RFP. We will have some time at the end for questions and answers. The last day to ask any questions that posted to FMPS is January 29th at 12 p.m. And like I said earlier, this presentation is recorded and it will also be posted on our FMPS system. I do want to note that this presentation is a summary of the RFP. If there are any discrepancies in this presentation, please always follow the RFP for a full listing of all requirements and expectations for this award. So moving on to the purpose and goals. So with this opportunity, we want to expand evidence-informed recovery services for people in recovery from opioid and other substance use disorder in the city of Chicago for the next 3 years. Our goals for this opportunity is to enhance the availability and diversity of resources that support recovery and destigmatize substance use disorder. We would like to improve access to evidence-informed recovery spaces and support systems for individuals and families affected by substance use disorder. And we would like to increase opportunities for recovery and underserved and under-resourced populations and communities, including people of color, youth, older adults, LGBTQI communities, sex workers, veterans, people impacted by gender-based violence, and people experiencing homelessness or housing instability. So for our program overview, CDPH is looking to support and promote a wide range of recovery programs and support services for people in Chicago. We seek to fund evidence-based, evidence-informed, and/or emerging practices that support recovery from opioid and other substance use disorders. This includes, but is not limited to, peer recovery support programs, group-based recovery support programs, art, music, and physical fitness or movement-based programs, faith and spiritually based interventions, and other programs that seek to support the 4 domains of recovery, which are health, home, purpose, and community. All programs funded under this opportunity are expected to meet each participant where they are in the recovery process without the expectation or requirement of total abstinence. All funded programs will also be expected to operate with an understanding that substance use disorders are chronic, recurring conditions, and that return to use is common and not an indication of failure. So we are hoping to fund 10 agencies. This funding period is for 3 years. We want to expand access to evidence-based or evidence-informed recovery support services for people in Chicago. We would like to serve everyone regardless of income, insurance status, or citizenship status. We do want to recognize that there are many different pathways and styles of recovery programs. This opportunity seeks to promote a wide range of recovery programs and support services for people in Chicago. So some examples of evidence-based, evidence-informed practices under this opportunity includes, but is also not limited to, peer-based recovery support communities, recovery community centers and cafes, meditation and mindfulness interventions, faith-based recovery support, art and music therapy, movement exercise and support therapies, and group support or support groups, nature and wilderness adventure recovery support, and gender and sexuality informed recovery supports. So our priority populations include those most affected by SUDs and populations that have historically faced barriers to trauma-informed, culturally appropriate services include Black non-Latinx populations, males and individuals aged 45 to 65 years old, individuals who have been incarcerated, people experiencing homelessness, housing insecurity, and other socioeconomic vulnerabilities, older adults, veterans, people with disabilities, LGBTQI plus populations, pregnant or recently pregnant individuals, sex workers, people impacted by gender-based violence, and people with co-occurring substance use and mental health conditions. So some of the scopes of services for this funding opportunity. So we want to operate, or we would like to support operation of a recovery support program in the city of Chicago that utilizes evidence-informed or emerging practices to support people in recovery from opioid and other substance use disorder. Services must be provided at no cost to participants. No one may be turned away from receiving services funded under this award due to insurance status, income, or immigration status. Services may not be restricted to only participants of an existing program or patients in an existing treatment center. And services must be offered with a harm reduction philosophy that recognizes that return to use is common and participants will not be left unsupported if and when return to use occurs. We would like to ensure that the funded program employs certified peer recovery specialists and people with lived experience of substance use disorder, and overdose. We will also look if providers are providing Narcan at no cost, provide harm reduction education and resources to participants, staff, and communities. These are including resources such as fentanyl and xylazine test strips, information on safer substance use practices, and information on evidence-based treatment services like medication-assisted recovery programs. We would also like to see reports that include de-identified data on individuals served to CDPH on a monthly basis. So program overview, these are CDPH principles. All CDPH investments are guided by the following principles. CDPH delegates and their subcontractors are expected to integrate these principles into organizational policy and practice. Deconstructing racist systems, trauma prevention and trauma-informed services, cultural responsiveness, and health equity in all communities. Applicants must provide a description of how their agency and proposed program aligns with each of these principles. So some allowable costs are activities and cost. So this award, you may not fund the, oops, I'm so sorry. This award may not fund the purchase of naloxone, the purchase of drug disposal bags, or funding any type of drug take-back program, and operation of recovery home or other housing programs. Funded agencies are encouraged to register as a DOPP or a drug overdose prevention program with IDHS and SUPER to access large quantities of naloxone at no cost. So some eligibility requirements. So respondents must meet the following criteria to be eligible for this award. You have to have an office located in the city of Chicago, from which your agency offers services from. You would have to be good standing with the city of Chicago, and have the administrative, organizational, programmatic, information, technology, and fiscal capability to plan, develop, implement, and evaluate the proposed projects. If respondents do not meet these requirements, these eligibility requirements will not have their applications evaluated. Any complete applications will also not be evaluated for this funding opportunity. So, some more eligibility requirements. We are looking for organizations who have demonstrated a history of providing services to participants, regardless of an individual's ability to pay health insurance status or immigration status, a history of providing services that are responsive to the unique needs of communities of high needs. This includes delivering services that are culturally contextual and linguistically responsive to the unique needs of people who use drugs and people at high risk of experiencing an overdose. A commitment to delivering services that recognize the impact that trauma has on individuals, communities, and across generations. A commitment to delivering services that are evidence-based or evidence-informed. This can be demonstrated both through proposing the use of interventions that have been demonstrated to be effective in generating the outcomes that agencies propose in their application, a commitment to centering the lives and experiences of people with lived experience of substance use disorder, and overdose in program design, leadership, and implementation, and a demonstrated history of working with people who use drugs in Chicago through low barrier, non-judgmental, and non-coercive programs and interventions. So the available funding that we have with this opportunity is $2 million for an initial term of 12 months, with up to two 12-month extensions. We would like to fund up to 10 applications. Each applicant or each person who is accepted for this funding opportunity will get $200,000 per year, depending on the service model, number of proposed persons served, and number of proposals funded. This funding opportunity is funded from CDPH corporate and opioid settlement funds, and the program budget cannot exceed the maximum available funding amount of $200,000. CDPH also reserves the right to award contracts to organizations that propose to serve priority community areas and populations most impacted by overdose in Chicago, even if those organizations have a lower total score in the evaluation process. CDPH reserves the right to award more than $2 million in total funding and to award more than 10 contracts if CDPH determines that furthers the objectives of the funding opportunity to do so. We know that this opportunity allows for a diversity of recovery support services program. And we want to recognize that each program will require a unique data collection and reporting process. So for data reporting, at minimum, awardees will be expected to report on the unique number of individuals served at the types of services provided. Applicants should propose a data collection and reporting strategy in their application, and successful applicants will work with CDPH in the first quarter after contract start date to refine the data collection and reporting process. For our program evaluation, respondents to this funding opportunity are expected to describe their program evaluation methodology to ensure the effectiveness of the proposed program, including metrics of successful implementation. Evaluation metrics and data management procedures should, at minimum, describe the following: how will measure and report on the proposed performance measures and deliverables, how client level and program performance data will be collected, details on applicant policies and procedures, applicant capacity for performing data collection, and how applicant will use performance measurement data for continuous quality improvement. So this funding may fund medical providers and other clinical staff, case management positions, outreach staff, administrative and grants management position, data collection, quality assurance staff, and program leadership. We do require that people with lived experience, whether working as a certified peer recovery specialist or not, participate in this program as well. And we also expect that all staff funded under this award are compensated at or above the minimum salary requirement in this RFP, defined by a minimum $20 an hour for a single adult with no children. You can refer on this link for the living wage calculator. So here is our evaluation rubric. There is 20 points for experience and capacity, 32 points for project description, 16 points for staffing plan, 4 for physical capacity, 6 for budget and justification, 14 for evaluation and quality improvement, and 8 if the applicant does align with the CDPH principles. So here are the key dates. This RFP was released on January 12th. Today is the bidders conference. The deadline for questions is January 29th, and then the application deadline is February 20th. Perfect. And then you can find the whole entire RFP on this link, and the link to apply is here as well. Now I'm just going to check the chat. Okay. So Lilia said, I'm unclear whether harm reduction, education, and outreach needs to be written into the budget, or whether we can clarify that we already provide all those services, all those resources to our patients in recovery. So if you would like to put, if your organization does have or does do harm reduction, education, and outreach, and you would like to have more funding towards that, you are welcome to write that in your narrative. Yes, so you are welcome to write that that you do harm reduction, outreach, education in your narrative, because it is one of the requirements that I touched on in eligibility requirements. And you're also welcome to read the RFP that I linked at the end of the presentation to help clarify that answer. So the second question is, do all service offerings we propose need to come together under one program? For instance, we have a lot we want to do with activities based around our community garden, and we also want to offer nutritional literacy and enrich our arts programming. You may even have room in the budget to support more CRSS education that we already do so. Is a cohesive narrative necessary, or can it be simply whatever recovery service development we have the capacity for? So yes, it can simply be whatever recovery service development you all have the capacity for. You're also welcome to apply to this RFP multiple times if you want to support the multiple initiatives that your organization has. But yes, you are able to simply create a narrative for the recovery service development that you have the capacity for. So the third question is in e-procurement. It says that respondents may attach the response if it is more than 4,000 characters. Is this true? I am not sure about the characters question, but I can ask our grants and finance team to see how to post or to attach a response that's less than 4,000 characters or more than 4,000 characters to have that posted. Okay, so if services need to be offered at no cost, is the application of a sliding scale unallowable? I'm from a federally qualified health center, and while no one is turned away who is unable to pay, we do utilize a sliding scale for treatment. So I am not sure about that question.
I can chime in on that. As long as you accept individuals who are unable to pay, you can do that. I mean, you can still have you charge, but you should have individuals who are not able to pay. You should be service individuals who are unable to pay, regardless of financial status, is what the application says.
Okay, thank you. I just wanted to follow up that with really quickly. So
Yes.
it is allowable for some people who are able to
If
pay
they're
based on this.
Yes, but
Okay,
we do focus on the group that we mentioned, those who are not able to pay, who are, um, are incarcerated, previously incarcerated, pregnant, that particular group, we still want the focus to be on those groups. But if they're unable to pay, if they're able to pay, you can use a sliding scale, but our focus is on the group that cannot pay.
okay. Thank you for that clarification, then.
Welcome.
Thank you, Ms. Shirley. Can we receive a copy of the PowerPoint presentation? So a recording of this presentation will be on the FMPS site. And the full copy of the RFP is there as well. I can see if we can send a copy of the PowerPoint presentation out to the group here. So the next question is, where is the best place to determine the priority service areas? Does Chicago Health Atlas have the data? Health Atlas have data this granular? Um, hang on, let me go back to the slide where it says priority populations. So there is data on the Chicago Health Atlas that highlights um, where in the city there is opioid data on the Chicago Health Atlas to determine what areas your organization would like to focus on for this funding opportunity. So I would start with the Chicago Health Atlas. Um, will an application be dismissed if an answer to one of the questions exceed 4,000 characters? No. We will, if your answer exceeds 4,000 characters, we will still read the whole entire application. Should the peer recovery staff already be in place upon submitting the application, or can they be hired after grant award? So you can hire the peer recovery staff after the grant is awarded. Just make sure that whenever you create your budget that you have the peer recovery staff on that budget. And we also pay for clinical note-taking licensing. I am not familiar what clinical note-taking licensing is, but I can ask our leadership and see if that is an available cost for this grant.
If that's part of your administrative costs, it does cover some administrative costs. This is Shirley, sorry. Did that answer your question? It also covers the data person as well, because I think there's a part in this presentation that says individuals who are working in your office collecting data could be compensated. Again, when you do your budget, you have to make sure that you include these people as part of your budget.
Perfect. Well, if no one else has any questions, please email us at osu.cdph@cityofchicago.org, or there is a link on the FMPS site to reach out to us as well while you are applying for this RFP. But thank you all for being here today, and I hope that I work with you all soon. Have a nice day.